Yeah.
Hey folks, I'm Howard Lux.
I'm Jeff Berg.
We are Two Boneheads. We have nearly 40 years of experience amongst the two of us, and normally we talk to you about certain injuries or certain treatment opportunities. And today we're going to talk to you about a topic that's near and dear to us, and that's second opinions. Jeff, what's the goal of a second opinion from an overall perspective?
Yeah, I think, some patients come for one of two reasons, at least that I can tell. One is they're suspicious that their first opinion is inaccurate. And so now they want to come in and get another opinion to sort of confirm their thoughts or get an opinion that they can now go with. And the other is they have some preconceived notion that the other opinion was accurate, but some hesitancy, and they want to have you confirm that the other opinion was accurate.
Right.
And I think the point that I try to make to my patients, and I think that's best for people looking for second opinions, is you ought to come in just as you did the first time with the first doctor, with really no preconceived ideas of what's going on, and let your second opinion really be an independent opinion.
Agreed. It's, we've talked about this obviously a lot amongst ourselves. We seem to be seeing more of those first types of patients now, more of the ones that are doubting not necessarily the diagnosis that they got by the first doctor, but whether or not the surgery is necessary.
Yeah. I think, we all have different opinions. Docs have different opinions, and there's all different types of doctors. Some are more aggressive in their treatments that they propose, and some more conservative, and some in the middle. And I think patients need to find the doctor that kind of treats them the way they want to be treated. Sometimes that first opinion isn't in line with how they like to be treated.
I agree. Not every injury is going to play out the same way in every patient. Every injury has a different personality. If I'm a couch potato and I slip and fall on the ice and tear my ACL, I'm different than the guy next to me in the office who's a triathlete who slipped on a trail and tore his ACL, even though they're the same age, height, and everything else. So you can't treat an MRI finding. You need to treat the patient.
I think, if you just open up the chapter to this disorder, it gives you a bunch of quick, brief ways to treat that patient without any of the nuance that, as you say, the personality the patients bring to the treatment.
Right.
So I'm always trying to fit the treatment to the patient rather than the patient to the treatment. And that's difficult, I think, because you have to have a discussion with the patient as to what their goals and aspirations and fears and anxieties and what they've tried, what they're willing to try, what they're not willing to try. And then through that, try to fit a treatment that works for them. It's not the same for every patient, like you said.
Agree completely. You hit the nail right on the head. And I find it's the experienced docs that ask the patients now, why are you here in the office? What can I do for you? How, what were you looking to learn today? Were you looking to learn that there was a surgery alternative for you or that there wasn't? Most people just want to know that it's not going to get worse. They're not going to die. And that they can go on and continue to walk, around after dinner with their husband or wife.
Yeah, unfortunately, honestly, most problems, obviously not all problems, but most of the problems probably you and I see, patients, they can wait.
Yep.
So they have time to figure this out. And sometimes the decision doesn't need to be made when they're talking to me. I could talk to them about, here's the options. Right. I'll go home and think about it for a little bit and try to figure out what works for you best. Because it's interesting you say older or more experienced docs. When I was younger, I used to tell the patients what I thought was right. But the problem is that I was wrong half the time because some patients didn't want that treatment. And even though it might be a reasonable treatment, it's not right for them. And you're right. Over time, you start to realize that it's not a cookie cutter. And that brings us to the other issue, Howard, which is, if you're not seeing your doctor, if you're seeing some emissary of the doctor, or the doctor's just looking at the report of the MRI, they're never going to be able to get that nuance from the patient. And so they're going to miss getting the correct treatment to the patient. And that's going to be a problem. In the end, the patient's not going to be happy, even if the treatment was reasonable and performed appropriately.
Absolutely correct. We have to return back to the basics of physical examination and history taking. Too many people. I personally called the physician's office for an appointment for a friend of mine, and I was asked, what MRI have they had done already? I was like, none. They're coming to you to be diagnosed. Didn't want to see the person unless they had something on the MRI.
Right.
That's a sad story.
Yeah. Unfortunately, I think it takes a whole lot more work, as you know, to talk to people and try to deal with that nuance. And it's a lot easier to just cookie cut. And unfortunately, it's a little sad state of our healthcare system, but there are docs out there.
Yep.
We're willing to talk with them.
Yep. You have one in New York, you have one in Virginia, and I'm sure we can help you find some others.
I think so.
Folks, we tried to tackle a really difficult topic today, the topic of second opinions. With the way the healthcare is going, with diminishing payments in the fee-for-service model, which is not going away so fast, that means that more and more of you might be told you need surgery when it actually might not be the right treatment option for you. So seek out a doc, look for second opinions, third opinions if necessary.
I agree.
Take care, folks.
Bye-bye now.